education presentation. This presentation is going to augment some of your learning in N136 to help you for your understanding about childbirth education, how we support laboring patients, how we can learn a little bit more about what happens in the birthing process. This will just augment your lecture material in N137. So we're going to go ahead and get started and pay close attention to some of the discussion questions that are presented throughout, because they will be questions that you will answer after you view this presentation. Okay. So I do want to let you know that this presentation, part of it was adapted from my teaching as an international childbirth educator. I'm certified by ICEA, which is the International Childbirth Education Association. And with that certification, what we try to do is empower new parents to make informed decisions about their childbirth experiences, as you can read here, through education, comfortable, respectful, and a fun learning environment. So as a childbirth educator, I can actually support birthing persons by giving them classes and courses that inform them more about their choices and some of the birthing experiences that they might have, and what they can do to and their partners to comfort them throughout the birth process. So some of the tenets of ICEA is compassion, collaboration, and choice. So the big things that we as childbirth educators want to impart to our patients is that we want them to have compassionate care, and that includes any persons of any gender, any ethnic background. We want to support all those who are birthing persons. The other thing we talk about is collaboration, and this is a big part of giving birth, is that we want to collaborate with the healthcare providers. So whether it's a hospital birth or home birth, or a birthing facility, we definitely want to collaborate with them and give the safest care. And then choice, giving birth, people have a choice on how they want their birth to go. Now that obviously is precluded if there's safety issues involved in the birth process, but understanding that there are choices and we want those choices to be made hopefully before the birth takes place. But we do want to participate with the healthcare providers and getting birth plans and developing a plan to have a birth that the patient feels is in their best interest and the baby's. All right. So here's just some of the things we'll be going over the learning objectives. We'll be talking about a couple different birth stories. We will talk about the birth preferences, being informed, the support person's roles, what they can do to help. We'll talk about the differences a little bit between unmedicated and medicated births. We won't get into a lot of that, but positive outcomes for birth stories. Then understanding, the big thing is understanding those comfort techniques, how we do labor support, how we do relaxation and mindful techniques for that. Some physical positions, the techniques to support, and the positions to help labor move along. Okay. So this kind of is an overarching theme that we try to portray to take a little bit of the fear out of giving birth, but it's a quote by Lori Harm, and it says, "We have a secret in our culture. It is not that birth is painful, it is that women are strong." And so thinking of that pain in terms of strength is it kind of is empowering, because that's really what it is. This giving birth requires a tremendous amount of strength, and that pain translates into strength. So that's what we try to empower our patients to understand. So we're going to look at two different birth stories. Pay attention to a couple of the different things in the stories. You'll be asked a question about them. So these are two completely different births. So we'll look at first Esmeralda and Ashley.
My name is Esmeralda, and I am 39 weeks and 4 days. I feel pretty excited to become a mother. I get to experience that beautiful moment on my own.
While Esmeralda is open to whatever happens, she is hoping for an unmedicated labor and birth. She plans to give birth with the support of family, friends, and 2 doulas.
Jameson, you guys all ready? We're excited to see you.
I'm Ashley Ann. I'm 31 years old, and I'm currently 33 and a half weeks along. We're coming close. I don't really have a birth plan. I just want to go with the flow, but I do want to apply some things to help with the labor, make it a little more comfortable.
Be open to what's going to happen. Be open to a lot of change.
Ashley is having her second child, but she's going into her birth experience with an open mind. She understands she may decide to receive epidural anesthesia to cope with pain. She'll be supported during labor by her husband, Joe.
My labor started at 4 a.m. I wasn't really sure if it was labor. I was like, maybe it's some 12 contractions there. And I do have like a contraction app on my phone. So I was definitely timing them.
Esmeralda calls her midwife and lets her know that her contractions are strong and frequent. The midwife tells her to get ready to go to the hospital.
My contractions were getting harder and harder, and they were starting to hurt. And I'm like, okay, let's see how this goes.
Will you call doctor?
Ashley's contractions come on sudden and strong. Her husband calls the on-call doctor.
Her contractions are about 5 minutes apart and last just over a minute apiece.
The doctor recommends they make their way to the hospital.
They checked me in pretty fast. I did not have any trouble. I was 4 centimeters dilated. I was just ready to get things going.
So far, Esmeralda's labor pain has remained manageable with movement.
It was definitely a really good support team. My doulas were definitely on it.
She did amazing. I know. She did. You didn't even labor.
We went to the hospital, and they were like, okay, you're 80% effaced, but you're 5 centimeters dilated. She goes, why don't you go in the bathtub? Just allow it to relax your body and see if you will just dilate some more. I really enjoyed the tub and the ball. And going for a walk seemed to help a little bit, but those two were my favorites. I went on the ball a lot because it really helped open up my pelvis.
My doulas definitely did help me have a natural birth. They both knew that was my plan, to not have any medication.
Esmeralda is having some back labor, but her doula guides her movement on the birth ball to help relieve the pain. Ashley's contractions have become very painful, so her healthcare team suggests she gets an epidural first and then break her water.
I just went for a walk because I'm like, you know what, let me get all loosey-goosey before I'm gonna have to sit in the bed for a while. They just gave me a numbing medicine in my back first, and it feels like a sting that lasts maybe 5 seconds, and then he starts putting the catheter in, and it's a lot of pressure, but it's not that painful, just a little bit. But oh my goodness, once he puts that catheter in, puts that medicine in, your legs go numb. But it was relaxing.
Yeah. It's also harder to get the girls that late.
Yes.
They did all of that first before breaking my water. And then the nurse was like, why don't I put a peanut ball to open up your pelvis? And I'm like, okay.
After 8 hours of labor, Esmeralda's cervix has dilated to 7 centimeters. Her doula suggests she uses a peanut ball to continue to dilate.
I think that one feels way better.
Does it?
Yeah. I felt like labor was taking forever.
Although she's feeling impatient, Esmeralda's labor is progressing and she's coping well. Occasionally, the baby's heart rate drops, so the midwife places her on oxygen and asks if she can use an internal fetal monitor to get a more accurate reading of the baby's heart rate. However, in order to do this, the midwife will need to break her water first.
Like some fluid's kind of coming out now. I don't know if you can tell at all.
Okay.
Ashley's labor progressed quickly after her water was broken. After 17 hours of labor, Ashley is fully dilated and ready to start pushing. Because of the epidural, Ashley still has little feeling in her lower body.
I felt like I could push the baby out, but feeling the contractions and the pressure to push was challenging.
After 13 hours of unmedicated labor, Esmeralda is 10 centimeters dilated. Her baby's heart rate is strong, and she's ready to push.
It definitely did take me a while to learn how to push. I myself felt what was working more, what breathing techniques were helping.
Can you come over a little bit more on your side? Just let your baby's heartbeat. Come on over. You're amazing, Ashley.
He's right there. He's coming.
Ashley's baby is crowning, and her nurse asks her if she'd like to touch the baby's head. She does, and feels overjoyed that her baby is almost born. The doctor asks Joe if he'd like to help deliver the baby.
So you can. It's going to be like a little push. Doing really good. Keep right in again. He's right here. Keep going. Just a gentle push. So he had me down up with the gloves and everything, and then explain hand positions. And he's like, "She's gonna push. Be ready." I'm like, okay, sure enough to push it. There it was, just real quick.
Come down here. Jameson.
Baby Jameson is placed on Ashley's chest, and she holds him skin to skin.
My emotions were just like in awe of just seeing him for the first time.
With assistance from her doulas, Esmeralda tries a few different pushing positions.
Pushing definitely felt painful, but the more she was going down, like I felt a bigger relief.
Her head is right there. And these next couple contractions, you feel a lot of stretching, a lot of pressure. Okay.
Finally, Esmeralda's daughter, Leyland, is born. The nurse places her baby on her chest.
What I felt when my baby was finally born was definitely relieved and happy. As soon as I heard her cry, all we're saying, she's here. When they put her skin to skin on my chest, it was like I have accomplished something. I did it.
He does a good job letting us know when he's hungry or wants something done, and that's really about it. It's eat and sleep. So
Yeah.
Getting a hold of him and help diaper changes is important. And that's a time that I get to bond with him a little more too.
And it's been a joy and a blessing, and it makes me so happy.
Looking back at my birth, I wouldn't do anything different. Giving birth to her was life-changing. That makes me feel really good about myself, and that I could do anything.
Whether you choose a medicated or unmedicated birth, the decision is yours. The more confident you are about the choices you make, the more empowered and positive you'll feel about your birth experience.
Okay. So there were some similarities and some differences between the two birth stories. And you can see the differences here. They both felt they were informed. They both made their own decisions. One said they wanted a medicated, the other said they wanted unmedicated. So in that they were informed and made their own decisions, and they established those birth preferences. Esmeralda used doulas, Ashley didn't, and they each had a support person or people with them. They used different types of labor and pushing positions, but you can see they were similar as well. And that will depend on how the baby is coming down and descending. So they use the peanut ball, and they use different movements and walking and some different, Ashley used the tub for relaxation, and their labors were different lengths. Now that can just be genetic, but it can also be sometimes the way that the body has prepared for the birth. And it would make a difference too if they were preterm. So here's the discussion questions. This is the first of 3 that you will answer for this module. Did you see anything in the video that you could use to teach your clients about their birth? Did you see anything that surprised you in either of those birthing scenarios? And why do you think that each person felt empowered during their birth? So one of the things we try also to impart are these little moments of we're supporting those moms when they're giving birth, but you try to get them to think in their head, I'm relaxed and I'm happy that the baby is finally coming. Now that can, as they progress, that relaxation might not be as evident, but we try to get them in that mindset. So in this section, we'll talk a little bit about the comfort techniques. So labor support, mindful relaxation, some of the physical techniques, the positions, and back labor. So this will be the next portion. Another quote from Janet Velasquez is, a strong intention, a relaxed body, and an open mind are the main ingredients for an active birth. And as much as we can try to get that body relaxed is going to help all of those 5 P's that need to happen during that birth process. That's going to be one of the main ingredients, is really that as much as we can do that relaxed body. And then open mind, just meaning trying not to get that cycle of fear going through the head as you're progressing through the stages of birth. So we're going to look at another birth video, and this one is about labor. Understanding the comfort techniques.
You might be feeling a little nervous about labor and how you'll cope with the pain. The good news is that there are natural pain relief methods that really work.
I was hoping to go unmedicated for my birth plan and just transition a lot from yoga balls, like bathtub, walking around the hospital would help.
I'm pretty sure I'm going to use pain medication during labor, so why should I learn about natural comfort techniques?
Natural comfort techniques are helpful in early labor. Even if you're planning to use pain medication, you're going to be spending some time at home, and you're going to want to know some things that will help you feel confident even before you get to the hospital, even before you get pain medication. Comfort techniques and coping skills are really life skills, and you can use them during labor, and you can even use them after you have your baby.
Trust your body's natural instincts. As your contractions intensify, your body responds by producing its own painkillers, chemicals called endorphins. These hormones make you feel calmer and more comfortable, so you can better cope with labor.
At that point, we weren't using any kind of medication at all. Didn't want to do an epidural. One thing is I needed to be able to move around, but also I kind of felt like I needed to be able to feel the contractions in order to be able to push.
Some people choose to give birth using no medications at all, relying instead on techniques such as relaxation and controlled breathing for pain. With these coping methods, you listen and respond to the sensations of labor.
Becoming more relaxed. Loading down. Now to your safe place.
Having an unmedicated childbirth isn't about being brave or being a hero. It's thinking about childbirth as something that your body knows how to do and allowing it to do it with as little intervention as possible. You might find the experience extremely empowering and rewarding.
Okay, so that's what we talk about. Birth is natural. Our bodies are built, the female anatomy is built to actually birth a baby, and the processes that do happen rather naturally. Sometimes they do need assistance, but it is a natural process and the stages that the body goes through. So now we're going to talk a little bit about birth preferences and a birth plan. So it's a flexible plan. It's kind of just mapping out your desires. What have you discussed with the partner that your desires are for that birth? The plan isn't set in stone, and it needs to be flexible just because things do change. But we do like to see something that's kind of spelled out. Is this something where you do want to have a support team by your side? Are you going to use doulas? Do you want to use a midwife? Do you want a medical team? Do you want a just an OB medical team? You have the right to decide what those preferences are. Excuse me. And a lot of people know what positions and comfort techniques they'd like to use. They want to plan and bring along the things that they think would be comforting, whether it's music or different scents or movies or just pillows, just personal items, and whether or not they want to use pain medication. And the big one is whether or not they want to breastfeed. And then also talking about the circumcision decisions that they would like to have. So we'll listen to this video.
I've been told not to invest too much into your ideal situation of how your birth will go, but I do have a plan where I have a doula, a licensed massage therapist, and my sister that will be in the back with me.
Creating a birth preferences plan is a way for you to communicate your wishes to those caring for you during your labor and after birth. Because every birth is a unique experience, birth preference planning empowers and informs you of all your options during labor. It's also a useful tool to let your care team understand your preferences. You don't have to create your birth plan from scratch. There are many options available online through your healthcare provider or from your childbirth educator.
Hydration and nourishment, like to eat light snacks, drink clear fluids, or would it not bother you for IV hydration if necessary?
Yeah, I don't want IV. So I've been using a birth preferences plan checklist to have one spot where I can have all my birth preferences clear and listed. So me and him can be on the same page. And so the hospital knows exactly what I want and what I need. What needs to be included in my birth preferences plan?
I would say list things that are important to you. Do you plan to use pain medication? Are you going to breastfeed? Who's going to cut the cord? Who do you want in the room with you? All those kind of things. We love for you to have a birth preference plan, but it's important to be flexible. Unfortunately, sometimes birth doesn't go exactly as planned, and so we want you to still have a great birth experience.
I actually requested a mirror because as a person delivering, you don't necessarily get to see what's going on down there. I've always wanted to. So I did request it. Unfortunately, he came too fast. The baby did come too fast, but I think I saw enough for the both of us. So I think it worked out perfectly. Yes, it did.
So let's talk about birth plan since it's your second baby.
Review your birth preferences plan with your provider during your pregnancy. And find out if your birthplace can accommodate your wishes. Remember, the goal isn't to stick to a predetermined plan, but to ensure the safest possible birth for you and your baby, while making empowered and informed choices throughout.
Okay. So now we'll talk about the support team.
During labor, it's important to have continuous hands-on support from someone you trust. Your partner, a family member, or a friend can help create a positive labor experience. especially if they're well informed about the birth process, comfort techniques, and your wishes. You can also consider having a certified doula, a professional labor companion who offers physical, emotional, and informational support to you and suggests comfort techniques when you need them. Some hospitals have doulas on staff, or you can hire one privately.
So I sought out a doula, and as soon as I met our doula, whose name is Amy, and she's amazing, I felt relieved. Like in our introductory meeting, I was just like, okay, I feel so much better. This is someone who has a lot of experience. I have no experience with childbirth, so she has a lot of experience, and it's somebody who's going to be there just for us.
What are the benefits of using a doula?
Studies show that your birth experience feels more positive to you when you have that professional support person in the room with you. You're more likely to succeed in breastfeeding. It's less likely for you to have an unplanned cesarean. It's also less likely for you to use pain medications if not using pain medication was your goal.
Partners and support people. Your job is exciting and challenging because you need to be unconditionally supportive and caring, no matter the circumstances. Throughout labor, use touch and massage, and recommend changing positions when necessary. It's important to be flexible and adaptable. If it isn't working, suggest something different.
I mean, I was just trying to support her in every way I could. We had soothing music, back pressure seemed to help a lot.
He got me lots of delicious popsicles whenever I wanted them.
Yeah.
Your support person or team doesn't need any special skills or training, but they should understand what to expect from each stage of labor and learn about natural coping methods. Practicing these methods ahead of time can give your support person confidence and reduce their anxiety.
So one of the people that was there as my labor support actually got down on all fours and let me put my feet on them so that I could stretch out my hips and just open up a little to prepare myself for the birth. Honestly, I don't know how long they were down there for, but I'm sure that they were getting really tired too.
Talk to your support person or team about your hopes for your baby's birth and what you would or wouldn't like to happen. This is where your birth preferences plan comes in handy. Combining good communication, positivity, and flexibility will lead to a more positive birth experience.
Okay. So that leads to a couple more questions. So who can make up a birth support team? And explain 2 roles of a doula. And then the last one is, what are things you noticed in the video aside from the support team that were implemented for labor support? So next we'll talk a little bit about what are some of the things you can bring to pack getting ready for labor. So comfy clothes, massage aids are good. The hospitals usually have the birthing fitness balls, but if they don't, if you're at a rural facility and they don't have that, you can actually bring in your own birthing ball. Aromatherapy, mood lighting if you want some different lighting, music, and snacks if that's something that's allowed. Now, it used to be that they didn't allow any food before going into labor because of the possibility of a C-section, and that's kind of gone by the wayside for most hospitals now because we know that it takes a lot of energy to give birth, and providing the snacks and bringing some extra things in for some energy is very, very helpful. So these are some non-pharmacological tools that you can have. They may be on the unit or patients can bring them in to help cope. A sound machine, aromatherapy, combs. And the thing about combs is something that you can squeeze on and it can deflect that pain pathway. That pain pathway, if you create a little bit of distraction on squeezing that comb, that will help. I know a lot of people ask, what's a comb for? To comb my hair. Some tennis balls to rub on some of those tender spots. A rebozo. So that rebozo is that colorful towel or blanket that you can wrap around the abdomen for support. And you've seen it used in a couple of the videos. And a TENS unit, and that is the electrical stimulation, therapeutic stimulation unit. And LED candles. If they have a tub or shower, you can use the hydrotherapy and sit on the ball even in the shower and use the handheld, or just having the water splash on your back. Peanut balls and birthing balls, again, those are usually provided. The birth sling, that is similar to a rebozo, and then a massage or oil. And if there's any affirmation cards or photos, those are things that could be used. Okay, so we're going to see another video on some of the relaxation and mindfulness techniques.
Preparing for birth includes learning about comfort techniques that can ease labor pain. Your brain is a powerful tool in managing pain, and these techniques help you focus your energy in a way that is mindful. This can lead to a positive and productive labor. Creating a calm atmosphere helps relax your mind and body. When your muscles are relaxed, pain is reduced. Your body produces fewer stress hormones, and more oxygen flows to your baby. What we see impacts our emotions and behavior. Consider using soft lighting, such as an LED candle, to help you feel warm and tranquil. Music can help you relax and work through your contractions. You may find certain sounds like ocean waves, rain, or chirping birds helps you through contractions. Certain smells have a calming and comforting effect. So if you're planning to give birth in a hospital or birth center, you can ask about bringing an aromatherapy diffuser and some essential oils. Visualization and active imagery are effective tools to use during labor. One way to use visualization in labor is to draw a mental picture of what is going on inside the body. For example, picturing your cervix opening or your baby dropping deeper into your pelvis can help you relax through contractions. Active imagery is a journey your mind takes to a relaxing place, such as a beach, a waterfall, or watching clouds float by. The purpose of active imagery is to reduce tension by concentrating on a place and mood separate from your current situation. For example, imagine that each contraction is an ocean wave. Picture your baby's movement inside of you, while imagining what it will feel like when you hold your baby for the first time,